Hello great nurses, welcome to the Career Pathway channel where we guide nurses on their pathway to success. Here is your career coach. Today we'll be discussing Module 6. In NUS 112 Module 5, we discuss the principles of optics and waves, including light waves, sound waves, and how they apply to nursing. Today in Module 6, we'll discuss the various measurements and units that are relevant to nursing practice. Let's dive in. As we all know, the circles to success are as follows. These are the key to note. Red circle indicate that these areas are relevant for your next examination. Orange circle indicate that these areas are relevant for your clinical posting. And green circle indicates asking you to come back to this video later. The specific objective for Module 6 are as follows. 1. Enumerate types of measurements commonly carried out by nurses. 2. Explain standard international units, that's SI unit. 3. Identify the various SI units and their related English unit conversions. 4. Explain the conversion of the units identified in 3 above. 5. Explain the following measuring instruments and their uses: the barometer, the sphygmomanometer, the hydrometer, and the urinometer, and of course the fluid hydrometer. 6. Explain the following: characteristics of pressure in fluid, specific gravity. 7. Discuss the following and their application to nursing: Pascal's law, Boyle's law, buoyancy, and Archimedes' principle, viscosity. Let's dive into Objective 1. Objective 1 says enumerate the types of measurements commonly carried out by nurses. Take note of this. In 2023, unit conversion errors caused 12% of fatal medication errors. Knowing that 1 kg is equal to 2.2 pounds isn't trivial. It is why your patient doesn't get 220 milligrams instead of 100 milligrams of a medication. So it is very important that we understand measurement so we know when a medication is underdosed or overdosed. Take note of this. So it is important for you to know that 1 kg is equal to 2.2 pounds. Common measurements used in nursing. Nurses carry out the following measurements. 1. Vital sign measurement: blood pressure, pulse, temperature, and respiratory rate. 2. Fluid measurement. Nurses carry out intake and output charts, urine output, IV fluid administration. So nurses carry out weight and height for drug dosage and BMI calculations. BMI is basal metabolic index. Number 4. Nurses also carry out blood glucose monitoring using glucometer readings. 5. Wound measurement. Nurses measure size, depth, and exudate amount from wounds. 6. Drug dosage measurement. Nurses measure liquid in mils, solid in milligrams, and gaseous in inhalation units. As a form of summary for the measurements carried out by nurses, we want to look at their nursing relevance and how we can avoid errors. Number 1, weight. Weight is applicable to nursing in cases of dosing, milligram and kg, fluid balance, and nutrition assessments. High risks to note: overdose in pediatrics. A 10% weight error will lead to increase in 10% dose error. Example in vancomycin toxicity. Number 2 is height. In nursing, height is applied in BMI calculation, pediatric growth chart, ICU ventilator settings. Risks to note: misclassification of obesity will lead to incorrect drug dosing. For example, in heparin, that could be dangerous. Number 3, nurses also measure temperature. In nursing, temperature is applied in infection screening, hypothermia or hyperthermia, and their management. Missing sepsis. If fever is above 37.5 and as a nurse you are diagnosing less than 38 degrees Celsius, that could lead to delayed antibiotics administration and eventually lead to septic shock for your patient. Blood pressure measurement is applied in hypertension screening, shock assessment, and medication titration. High risks to consider. If the cuff is too small, it will lead to false hypertension, which may lead to unnecessary antihypertensive medication, leading to falls. 5. Pulse oximetry. It is applied in respiratory status monitoring and oxygen titration. High risk to note with pulse oximeter. Nail polish or dark skin will lead to false low reading. If the nail is polished or the person is dark skin, it will lead to false low reading, leading to unnecessary intubation. Number 6 is urine output. How does urine output apply to nurses? Renal perfusion or fluid balance in mils per hour. If urine output is less than 30 mils per hour and you did not identify this, it will lead to mixed acute kidney injury, which will lead to the patient being dialyzed. 7. Pain scale measurement. Pain scale measurement is applied in pain management efficacy. There is a 0 to 10 scale, which is called the Wong-Baker Faces Scale. This Faces Scale indicates facial emojis that also indicates the level of pain the patient is undergoing. What is the risk for us to take note of? Underestimating a patient's pain may lead to inadequate anesthesia administration. Underestimating the patient pain may lead to inadequate analgesics being administered. This will lead to delirium in the elderly. Objective 2. Explain the standard international unit. You want to understand SI unit. SI unit prevents errors. The US is the only industrialized nation using English units, but all drug label, lab reports, and research use SI. Confusing grains, which is English, with grams, which is the SI unit, caused the 1999 heparin overdose epidemic, leading to 28 deaths. In 1999, 28 people died as a result of confusing grains for grams. So this is very serious. We want to explain SI unit. SI unit is the internationally recognized system for measuring physical quantities to ensure uniformity and accuracy. It is the metric system used globally. It is the metric system used globally in science and medicine, based on 7 base units: meter, kilogram, second, ampere, Kelvin, mole, and candela. How is this important to the nurse? It prevents error in drug dosage. It facilitates clear communication among healthcare professionals globally. It ensures consistency in patient care. Quantity, SI units, and nursing relevance. Mass is measured in kilograms. Drug dosing we use mass in drug dosing. For example, 2 mg per kg morphine. Length, we use length in wound measurement, and height. Length is measured in meters. The next one is time. We use time in IV drip rate, drop rate per minute. CPRO compression timing. Time is measured in seconds. The next one is volume. We use volume in fluid intake output in medication dilution. Volume is measured in liters. You will be taught about the fundamental units, which is mass, length, and time. You will also be taught about scalar quantities and the rest of that in class. But these are the areas that apply to nursing. Objective 3. Identify SI units and English units conversion. So these are the various units and how they convert. Length is measured in meters. 1 meter is equals to 39.37 inches. Mass is in kilograms. 1 kilogram is equals to 2.205 pounds. Time is in seconds. It is same in both systems. Temperature is in Kelvin or Celsius. Take note that we can convert Celsius to Fahrenheit using this formula. Calculations will be done in class. Take note of those calculations. You can practice so you can get used to all the formulas. Volume is measured in liters. 1 liter is equals to 1.057 watts. Pressure is measured in Pascal. 1 Pascal is equals to 1 atm, and 1 atm is equals to 101.325 pascals. 1 atm is equals to 101.325 pascals. As a form of telling us the risk involved when we don't get these calculations right, we want to take note of the SI unit, the English equivalent, nursing conversion formula, and the risk case scenario. 1 kg is equivalent to 2.2 pounds. 1 pound, to convert pounds to kg, you divide by 2.2. To convert kg to pounds, you multiply by 2.2. If you don't do this, pediatric morphine ordered 0.1 milligram per kg for 22 pounds infant, equal to 1 milligram, not 2.2 milligram. You see the risk involved. 1 liter here is equal to 1.06 watts. From liter to oz, you times by 33.8. From oz to liters, you divide by 33.8. Fluid restriction, 1.5 liters per day equal to 50.7 oz, not 48 oz. You may say 48 and 50 are close, but they are not the same. It is a common error. 1 meter is equals to 3.28 feet. From meter to inch, you times by 39.37. From inch to meters, you divide by 39.37. This is applicable in neonatal length. 50 centimeter is equals to 19.7 inch, critical for gestational age. 1 gram is equals to 1.035 oz. Grams to milligram, you times by 1000. Milligrams to microgram, you times by 1000. Risk case scenario. Heparin 5000 units equals to 5 ml, not 0.5 ml. If you do this, you may have decimal errors. Decimal errors can kill. Memory aid. King Henry died drinking chocolate milk. This is a memory aid for us to know that 1 kg equals to 1000 gram, 1 gram equals to 1000 milligram, and 1 milligram equals to 1000 microgram. Objective 4. To explain the conversion of the units we have identified. Let's explain the conversion of the units we have identified. The first one is length. If you want to convert from centimeter to inches, you must understand that 1 inch is equals to 2.54 centimeters. Weight is in kg. To convert from kg to pounds, you must understand that 1 kg is equal to 2.205 pounds. From temperature, to convert from Celsius to Fahrenheit, you must understand that this is the formula for you to use. Degree Fahrenheit equals to degree Celsius times 9/5 in bracket plus 32. Next one is volume. Mils. From mils to teaspoon, you must understand that 5 mils is equal to 1 teaspoon. Example in nursing. A patient requires 500 mils of IV fluid. That is 500 ml is equal to 0.5 liters. Temperature reading. Temperature reading 39 degrees Celsius is equal to 102.2 Fahrenheit. More calculations will be done when you are with your lecturers. Step-by-step explanation. Weight conversion, pounds to kg. Scenario: patient weighs 154 pounds. The dose is 5 mg per kg. How do we do this? You divide the pounds by 2.2. So 154 divided by 2.2 will tell us the weight of the patient. The patient is 70 kg. How do we calculate the dose? 70 kg times 5 mg per kg will give us 350 mg. So for this patient who weighs 70 kg, we have to give 350 mg of the medication. If we fail to do this, forgetting that we should divide by 2.2, it will lead to us multiplying 154 by 5. This will make us to give the patient 770 milligrams, which is 2.2 times an overdose. That could be fatal. The next one is volume conversion, ounce to mil. Scenario: patient drank 8 ounces of water. Fluid intake tracking. 1 ounce is equals to 30 mils. This is clinically rounded. 8 ounces times 30 mils will give us 240 mils. If we use 1 ounce as 29.6 mils, this could make us give 237 mils instead. You may say this is insignificant for intake, but this is deadly in IV medication. Example: 10% error in digoxin. Dose conversion, microgram to milligram. Scenario: nitroglycerin drip, 5 microgram per minute. Solution: 50 milligram per 500 ml. To convert from microgram to milligram, we say 5 microgram is equals to 0.05 milligram. Calculate 0.005 milligram per minute times 500 milligram per 50 milligram. This will give us 0.05 mils per minute. This is a nursing hack. Let's take note of it. For converting from microgram to milligram, you move the decimal place 3 times to the left. So 5.0 microgram will give us 0.005 milligram. Objective number 5: basic measuring instruments and their uses. Number 1 is barometer. Barometer measures atmospheric pressure. It is important in respiratory condition. Sphygmomanometer measures blood pressure. It is crucial for cardiovascular monitoring. Hydrometer measures density or specific gravity of a liquid. It is useful in laboratory settings. Urinometer measures the specific gravity of a urine. It is useful in assessing kidney functions and dehydration. Fluid hydrometer measures density of other medical fluids. Let's look at it as a form of summary. Barometer measures atmospheric pressure in millimeter mercury or in kilopascal. Nursing application: altitude sickness, risk in air transport, affects IV flow rates at high elevation. When barometer is not recalibrated to suit your location, it will lead to false low pressure, leading to missed hypoxia risk. Sphygmomanometer. What's the physics principle? For auscultatory method, cuff pressure systolic will lead to blood flow stop, which will lead to release, leading to correlative sounds. How does it apply to nursing? Hypertension screening and shock assessment. Common errors: when the cuff is too small, it will lead to the increase of the blood pressure by 10 to 50 millimeter mercury. This is erroneous. For example, hydrometer. Physics principle of hydrometer: it measures fluid density via buoyancy. Float depth is directly proportional to density. Nursing application: urine specific gravity, hydration status, battery acid testing in crash carts. Urinometer. The physics application of urinometer is specialized hydrometer for urine. Enables us to measure renal function assessment. Specific gravity that is 1.005 to 1.030 is normal. If it is less than 1.010, it is equals to diabetic insipidus. Fluid hydrometer. The physics principle is that fluid hydrometer measures IV fluid density. For example, TPN, which is total parenteral nutrition. Nursing application. Verifying correct TPN concentration will avoid osmotic diarrhea. This is important. For sphygmomanometer, cuff bladder must cover 80% of the arm circumference. If the arm is 35 cm, use large adult cup, not standard. Please take note that in your clinicals, you must use a sphygm cuff bladder that is suitable for patients. Some patients are very big, so you may need to use larger adult cup for them. Objective number 6. To explain the following characteristics of pressure in fluid and specific gravity. If specific gravity is more than 1.030 in urine, there could be possible contrast dye toxicity. You need to notify radiology. Pressure in fluid and specific gravity explained. What are the characteristics of pressure in fluid? 1. Pressure in fluid acts equally in all directions. This explains edema in dependent body parts, for instance, the ankles. Another characteristic of pressure in fluid is that it increases with depth. For the formula for pressure, you must understand that pressure, which is G, is directly proportional to height. So pressure increases with depth. Number 3, it depends on fluid density and gravity. It depends on pressure in fluid, depends on fluid gravity which is G, and fluid density. Hydrostatic pressure. Hydrostatic pressure drives capillary fluid exchange, leading to increase in heart failure, which leads to pulmonary edema. Pressure increases with depth, as shown in the formula. Nursing impact. Your IV bag hung higher leads to increase in pressure, which leads to the increase in flow rate. So if the flow rate you want it to increase, you have to take, that's why the drip bag is usually elevated. Example in trauma or resuscitation. Specific gravity. Specific gravity is the ratio of the density of a substance to the density of water. How does this apply to NOS? It is used in urine tests. Normal urine specific gravity is 1.010 to 1.030. Take note. Urine specific gravity that is greater than 1.025 is dehydration. So it means that the urine is concentrated. If it is less than 1.010, it means the person is overhydrated, and that could be a sign of renal failure. Blood specific gravity. Specific gravity is also applied in nursing with regards to blood specific gravity. It helps us to detect polycythemia, which is the increase of red blood cells. Okay, if specific gravity of the blood is on the high side, or anemia if specific gravity is on the low side. Okay, TPN, total parenteral nutrition specific gravity. It helps us to verify osmolarity. The safe range for TPN is 1.005 to 1.020. Objective 7. To discuss the following and their application to nursing. Pascal's law, Boyle's law, buoyancy, and Archimedes' principle, including viscosity. Boyle's law states that the pressure of a gas is inversely proportional to its volume at constant temperature. At constant temperature, pressure is inversely proportional to volume. Pressure is inversely proportional to volume as shown in this formula. Nursing application of Boyle's law. Mechanical ventilation, oxygen therapy, and anesthesia machine. Boyle's law is also applied in syringe use. When you pull the plunger, it will increase the volume, leading to a decrease in the pressure and to lead to aspiration of the fluid. So syringe work with principles of Boyle's law. Ventilators also work with the principle of Boyle's law. In the exhalation phase, there is decrease in lung volume, which will lead to increase in pressure and then lead to the pushing of the air out. Number 4, decompression sickness. Decompression sickness is also an application of Boyle's law. Rapid ascent will reduce ambient pressure, leading to nitrogen gas bubbles expanding. That will lead to increase in volume. When drawing medication, pull plunger slowly. If you don't pull the plunger slowly, it will lead to rapid expansion. That is Boyle's law, which will create vacuum, leading to shattering of the ankle. So, for your practical purpose, take note of this. Pascal's principle. What is the principle of Pascal's law? Pascal's law apply pressure applied to a confined fluid is transmitted equally in all directions. That's Pascal's law. In your class, you may be doing some calculation. So note that the principle of Pascal's law states that pressure applied to a confined fluid is transmitted equally in all directions. What is the application of Pascal's law in nursing? Hydraulic bed, syringes, infusion pumps. These hydraulic beds or air beds are used to prevent decubitus ulcers. So basically, it's an application of Pascal's law. In the air bed, the air is spread all over the bed, making it very difficult for a patient to get pressure ulcer. Nursing application is applied in IV therapy. Squeezing the IV bag will increase pressure, leading to increased flow rate. Example, rapid fluid bolus. You want the fluid to go very fast because of an emergency. That is Pascal's law. 2. Hydraulic lift. In hospital beds, they use fluid pressure to raise or lower the patient safely. 3. Chest tube drainage. Chest tube drainage, which is in regards to underwater seal drainage, works with the principle of Pascal's law. Water sealed chamber relies on pressure equalization. Critical error. If the chest tube is kinked, it will break Pascal's equilibrium, leading to tension pneumothorax. That is why in underwater seal drainage in the hospital, one of the principles is that you should not kink the chest tube. Buoyancy and Archimedes principle. Archimedes principle states that if a substance is partially or totally immersed in a fluid, it experiences an upthrust which is equal to the amount of water displaced. What is the principle of buoyancy and Archimedes principle? An object immersed in a fluid will experience an upward force equal to the weight of the fluid displaced. Buoyancy force is equal to weight of displaced fluid. Application of buoyancy. It is applied in hydrotherapy and patient immersion baths. Nursing application. Hydrometers or urinometers is one of the applications of buoyancy. Float depth is directly proportional to fluid density and the fluid that is displaced. It is also applied in neonatal care, underwater weighing for body density. This is under research also. Pressure ulcers. Immersion in water will reduce effective body weight, leading to relieving of pressure. Real-world impact. In the burn unit, water beds use buoyancy to reduce the pressure on the wounds by 80%. Viscosity. Viscosity is the resistance of fluid to flow. Fluid resistance to flow is viscosity. It is measured in poise. How is it applied? Blood viscosity in patients affects blood pressure perfusion. Also, viscosity is applied in nursing via the following. Blood viscosity. If there is increase in red blood cells, which is polycythemia, increase in polycythemia will lead to increase in clotting. Decrease in hemoglobin will lead to tachycardia. All these are viscosity principle. IV fluid selection. In IV fluid selection, viscosity plays a role. For instance, hypertonic solution has high viscosity. They require large bore catheters, e.g. TPN via central line. In using TPN via central line, they use large bore catheters, not the ordinary catheter we know. Number 3, mucus clearance is also apply viscosity. So mucus clearance also apply viscosity. Hypertonic saline nebulizers will reduce viscosity, leading to the patient mucus clearance. Mucus clearance also apply viscosity. Hypertonic saline nebulizers will reduce viscosity, which will enable the patient to cough easier. For instance, patients with cystic fibrosis. High risk scenario. Administering vancomycin IV push, which is high viscosity, will lead to vein irritation. That's why sometimes in the hospital they will tell you that you should push slowly. You should push the medication slowly. This is to prevent vein irritation, leading to phlebitis. Always infuse over 60 plus minutes. Okay, why measurement matters? The nursing bottom line. You don't just record numbers, you prevent death with them. When you convert pounds to kg correctly, you avoid pediatric doses. When you use the right cup size, you prevent false hypertension and unnecessary drugs. When you check urine specific gravity, you catch renal failure before creatinine rises. Master measurements and you turn every number into a lifeline. I want you to answer these questions in the comment section as we round up. A 220-pound patient needs 0.5 milligram per kg drug. What is the dose? Let me know the answer in the comment section. Why is urine specific gravity 1.001 dangerous? Let me know in the comment section if you follow this class. Question number 3. A patient weighs 44 pounds. The dose is 10 mg per kg. How many milligrams will be given? These are important for your clinicals. Measure blood pressure with the correct size cuff. Measure blood pressure with 20% cuff too small. Measure blood pressure with arm below heart level. How does this each influence the BP result? How does each of A, B, C influence your BP result? Measurement of specific gravity. Specific gravity of a tap water in A is 1.000. Simulated dehydrated urine is 1.030. Simulated renal failure urine specific gravity is 1.008. Consequence: misreading specific gravity 1.008 as normal will make you to miss diabetic insipidus, leading to fatal hyperthermia. We want to look at measurement of specific gravity. For instance, in example A, specific gravity of tap water is 1.000. Gravity of dehydrated urine is 1.030, and in C, simulated renal failure urine is 1.008. What is the consequence when you miss all this? When you miss to know that this is supposed to be 1.00, when you miss that this is supposed to be 1.030, or when you miss that specific gravity for renal failure urine is 1.008. If you misread a renal failure specific gravity of urine of 1.008 and you take it to be normal, it will make you to miss diabetic insipidus, and that will lead to fatal hypernatremia. As I round off, the circles to success are as follows. Take note of the areas your tutor teaches with regards to calculation. I didn't do much calculation here because this is a video, but in your class or if you have time, your lecturers will always put you through. Green circles, go through this video again. Orange circles, take note of all the practical areas that I talked about. I want to thank you for staying tuned up to this time. In case you have not subscribed to our YouTube channel, kindly subscribe to this YouTube channel. It helps us to know how you enjoy our video. Till we meet in Module 7. Goodbye.